Hello, I'm Jeff Gold, and welcome to another Maverick Minute. Today we have the pleasure of being joined by Julie Kolasek, and Julie is the clinic nurse lead from the Nebraska Medicine UNO Health Center. Julie, thanks so much for being with us today. It's a real pleasure.
It's my pleasure too, Dr. Gold.
So I understand that you've actually been with UNO for about 20 years now, is that right?
That's correct.
And always part of the UNO Student Clinic?
Yes, we had a wonderful clinic, and it has just elevated now with Nebraska Medicine coming.
So that change occurred, as I recall, last summer, is that right?
July 1st we made that change, yep.
And how would you characterize some of the things that are different? So, you know, if there was a student that wanted to know before and after about what's new, what's different at the clinic, how would you describe that to them?
Well, I think we have tremendous resources now for the student, a lot of expertise within the Nebraska Med health system. And just we've used so many of those resources now. Referrals out to urology, referrals out to orthopedics, referrals to the wound care, the burn care center. And those are just smooth transition referrals, and all documented within the electronic medical record.
So let's talk about that for a second, because that's one of the things Nebraska Medicine has really spent a lot of time under the leadership of Dr. Michael Ash and others, is to try to make the electronic medical record really helpful for patients and for the healthcare professionals who deliver that care. How does that really help the students that get care in the clinic?
Well, I'll tell you one thing, we're not looking for lost charts anymore. We had paper charts, and we would spend a lot of wasted time looking for those lost
days
charts.
Where I used to run around looking for charts and x-rays, and those days are they're gone, right?
They are gone. They're gone, and we're loving that. It's a learning curve, for all of us, and but we're learning to utilize all the tools that are within it. I think one of my favorite ones is being able to send a message to the providers. For students, or our patients, they can send messages and get prescription refills. They can talk to their provider. They can print out their immunization records. There was multiple paper processes for all these before, and now they have access to their medical record.
Well, I mean, that's one of the really important things about transparency in healthcare these days, because the ability to know what's in your chart and the ability to understand it and communicate it with others. But I remember the days where students would struggle to get even their immunization records pulled together if they were applying for a summer internship or something of that nature, where now it's probably, 2 clicks and print and you're done.
Absolutely.
Or probably not even print, probably just send.
Send,
and it's done.
And if they're in one chart, they can print them out at home. I mean, if they're going to UNMC, we have a lot of students that go from UNO to UNMC, and they have extensive more immunization requirements, being that health college. And so there's a lot of things we're kind of getting done for them, and now they have access to all that.
So have we changed the hours of the clinic at all, or what are the hours now?
The hours are 8 to 4:30. So
Monday through
Friday. We have intermediate care. We have a Midtown one, and that's kind of our after-hour place that we can refer students to. Of course, trying to keep them out of the emergency room.
Of course.
This level of care, and the Midtown one is a convenient one.
So how do they get that information? Is it on a website, or
Yes, we have it on our website that they can go to with contact, phone numbers and address and that.
And can they electronically make an appointment to be seen in the clinic, or do they just show up? How does it usually work?
It is a walk-in clinic, so they don't take appointments. So it's kind of first come, first serve.
And if we have a student or a faculty member or a staff member that wants more information about either the hours or the services that are provided by the clinic, how would they get that information?
Our website's been updated, so we have the intermediate care information on it, our services are on it, contact information. So it's a good go-to place now, is our website.
And is there a phone number during the hours that the clinic is open?
Yep, that's 402-554-2374. So they can reach it. 2374.
Well, thank you so much for your 2 decades of service here to UNO, and thanks so much for making this transition to Nebraska Medicine so successful. It's a pleasure to chat today. And thank you for being with us today on this, Maverick Minute.